Hello and welcome to another edition of Sree's Sunday New York Times Read Along. Our guest this morning is Dr. Olajide Williams, Chief of Staff of the Department of Neurology at Columbia University and global leader in health disparities. He's also the founder and board chair of Hip Hop Public Health. We'll learn more about the great work they do in just a few minutes. Our host is Sreenivasan, the managing director for Arizona State University's Cronkite School of Journalism's Cronkite Pro. He's also the co founder of Digimentors, a digital and virtual events consultancy. My name is Neil Parekh. I am the executive producer and guest host of the show. We are live on Facebook, Twitter, LinkedIn, YouTube, and our Digimentors website. We're also live on Hip Hop Public Health's Facebook page and YouTube. Thank you very much for joining us today. Please like, please comment, please share. Let us know where you're watching from. Tag your friends. You won't want to miss this show. Hip Hop Public Health is doing some incredible work getting public health messages to youth in particular, with working with some hip hop icons. So let's take a moment and look at what a little bit of a preview of what's to come in today's show. Our guest on this week's edition of Sree's Sunday New York Times Read Along is Dr. Olajide Williams, founder and board chair of Hip Hop Public Health, an internationally recognized nonprofit that works with iconic hip hop influencers like founding artist Dougie Fresh, Chuck D, Daryl DMC McDaniels, and Ashanti, using music, art, culture, and science to create memorable content wrapped in hip hop to inspire, educate, and engage young people and ultimately save lives. Dr. Williams is the Chief of Staff of the Department of Neurology, a tenured professor, and Associate Dean of Community Research and Engagement at Columbia University's Medical School. He is also a co-chair of Columbia University's Medical Campus Anti-Racism Task Force. Known as the Hip Hop Doc, Dr. Williams is a board member of the Partnership for a Healthier America, where he helps guide health equity-related activities. Michelle Obama is the honorary chair. He is also an expert on COVID-19 vaccine acceptance in communities of color and COVID-related health disparities, helping Hip Hop Public Health develop a rap and reggaeton vaccine literacy series, Community Immunity. Sreenivasan is our host. I am the executive producer and occasional guest host, Neil Parekh. Paula Kiger helps produce the show, engaging with the audience on Facebook and LinkedIn. Sree has been hosting the New York Times Read Along for 6.5 years, with some amazing guests. The show is produced by Digimentors. We produce high-quality virtual and hybrid events for organizations big and small around the world. We also do social and digital consulting, training, and workshops. Again, Dr. Olajide Williams is our guest, live on Facebook, Twitter, LinkedIn, YouTube, and our Digimentors website. There's a little bit of a preview of what's to come. We have an exciting show today, as always. We want to get a sense of who's watching today. So let's take a quick look. Deborah Kerr is joining us. Deborah, always great to see you. And Miriam Berkeley. Miriam, thank you for watching. Always great to see you, watching from Hell's Kitchen. Lori Benson, the executive director of Hip Hop Public Health, is with us. Good morning. And thank you again for all of your help in putting this show together. Doug Levy is joining us from San Francisco, from Marin County, California, outside San Francisco. Thank you, Doug. Always great to see you up early. I know that you this is your usual time to get up, but we still are thrilled that you're choosing to join us at this time. Hi, Mom. No, this is not my weekly call with my mom. I'm not going to, catch her up on everything that's going on, even though my daughter Emily is starting school tomorrow. and she's very excited. But I'll catch up with my mom later. Mom, thank you for joining. Always great to see you. Dr. Sujana Chandrasekhar is joining us. Good morning. Sujana, I'm sure you're going to really be interested in the content we have today and talking with Dr. Olajide Williams. Patricia Freudenberg is here watching from Long Island. Patricia, thank you. And she's watching on LinkedIn. Again, we're live on Facebook, Twitter, LinkedIn, YouTube, and our Digimentors website. Paula Kiger is watching from Tallahassee, Florida. Paula, of course, is our producer, engaging with the audience on our Facebook and LinkedIn channels. Stefan Kaplan is watching from Ramsey, New Jersey. Stefan, always great to hear from you and have you watch. Check me out, huh? And who else is great? So let's see if we can bring on. And Christopher Gorman is watching as well from New York. Christopher, always great. Thank you for joining us. Let's go ahead and bring on our host, Sreenivasan. Sree, good morning. How are you doing today?
I'm doing great. A beautiful day in New York City, and wonderful to have a chance to talk about the amazing work of Dr. Olajide Williams and Hip Hop Public Health. And we are going to get a chance to read the newspaper with him and talk about all the important issues of the day, as many as we can fit in. We'd love to hear from you. Where are you watching from? Please tell us how your Sunday is going. Please feel free to ask Dr. Williams any questions you have. And Amy is watching from Fort Lee. That's Neil's sister is watching. Hi, Amy. Thanks for joining us. And we'd love to hear what your week is like. We're here in the US. We're ending the last few weeks of summer. As you heard that Neil's daughter is starting school tomorrow, and a lot of folks are. So just really, really happy to be with all of you today. We are going to take a look at the newspaper, and then we're going to bring Dr. Williams on and have him tell us about all the amazing work that he and Hip Hop Public Health are doing. And we are live on all these channels, Facebook, Twitter, YouTube, LinkedIn, and the Digimentors website. But you can tag your friends or hit share or retweet or like. And if you tag them, they can watch live, or as soon as the show is over, it will run on all of these channels, so they can replay it as soon as we are off the air. So thank you and welcome, everybody. What I wanted to do is just give you a quick glance at the New York Times and show you what's on some of the front sections, and then we'll bring Dr. Williams on. The lead story in the Times today is in chaotic exit, Trump delayed sorting records, opening legal risks, and we've been following that story. Odessa is defiant. It's also Putin's obsession. And here, young Ukrainians dancing in front of Odessa's Opera Theater in June in a video intended to send a message about what has been lost because of Russia's invasion. And we'll be talking about the power of music and the arts and culture to change the world. And this is one example of how that's happening in the Ukraine. And here, migrant influx tests New York as a sanctuary. So many important angles on this story. You may know that the governor of Texas is just putting migrants onto buses and sending them to cities like New York and DC. In US politics, even the phrase, the American dream, divides. So we'll be looking at that story and hearing about that. And a vision in the desert. Michael Heiser unveils a 1.5-mile sculpture in a Nevada valley. I don't know if that looks anything like a wall or fragments of a wall, but that would be on the arts and leisure section. And then here's an unusual story. People are flocking to pickleball and the ER. Pickleball is a game that's played mostly by middle-aged folks that is kind of a half-court tennis, has sort of like ping pong and all of that. But older people are now ending up in the ER, and so that's an unusual story. The Metropolitan cover is about an actor's unfinished business in Brooklyn. Michael K. Williams was devoted to making Black communities safer, and we will be approaching the story of how minority communities can feel safer, more engaged, more connected to everything, including public health, in our conversation with Dr. Williams. Not their first rodeo. New Jersey is home to one of the longest running shows of cowboy bravado. This might surprise some of you who don't know how much cowboy stuff there might be in New Jersey. Growing a beauty brand, Welleda's popular face cream evolved from following the rhythms of nature, and a hunt for love in the metaverse. Lots of talk about the metaverse. That was the Sunday Style section. The Sunday Business cover is how a CEO used viral fame as a lure. Dan Price won praise for paying his employees a minimum salary of $70,000. The adulation helped to hide and enable his behavior. He has been accused by multiple women of various sex crimes. A desert mystery is ready to open, and this is that mega sculpture in Nevada. And the real estate workers in the Catskills can't find places to live. We're seeing this in a lot of holiday areas or popular vacation spots. How do people who have to work there live there when prices are getting expensive? We also have a story about music on the cover of the magazine. Willie Nelson is turning 89 years old, and he's the last man standing according to this cover. And here we have the Times the Times Style magazine, making a statement. Whether slinky or stretchy or structured or severe, this season's fashion has something to say. And the book review cover is Love and Empire, Afterlives, a new novel from Nobel laureate Abdul Razak Gurna, is a big, bold, richly drawn novel of East Africa. Folks, tell us where you're watching from. We're so glad to have you with us. Ken Fisher says hello from Iowa, and Harvinder is watching. And we are so glad to have all of you with us. I see Patrice Webb from HHPH is with us as well, and Therese is here from Yonkers. Thank you so much for joining us, everyone. I think we're now ready to bring on the wonderful Dr. Olajide Williams. Let's put our everybody get ready to meet him. You will be as excited as I am to spend time with him, to learn from him. He's the Chief of Staff of the Department of Neurology at Columbia University. He's a global leader in health disparity, and he's the founder and board chair of Hip Hop Public Health, an organization we have the pleasure and honor of working with. And we want you all to check out hhph.org and also look up hhph.org on Twitter. So with that, let's bring on Jide, our friend. Thank you so much for being here. How are you, Doctor?
Hi, Sree. It's so good to be here. It's a real honor. I'm a big fan of this show, and I thank you for having me.
Well, we are delighted to have you with us. It's Sunday morning, 8:30. I know we had you on even earlier to get ready. Tell us how you're doing and how's your usual Sunday?
So my usual Sunday is usually the day that I try to relax when I'm not on active duty in the hospital. It's usually a day of family, of reflection. I try to read. I try to listen to music. And yeah, I just try to unwind. I think it's really important for all of us to carve out time for recreation, for relaxations, and sometimes, I like to spend time just on my own, in my own thoughts, in my own space as well. So Sunday really gives me the opportunity to do a lot of these things as I recharge my batteries for tomorrow.
Well, we're glad that you were able to squeeze us in on what should be a relaxing day for you. Let's talk a little bit about where we are with the pandemic, just to understand the incredible work that HHPH and Hip Hop Public Health have been doing. We'll talk about the organization, but just talk a little bit about your own experience through the pandemic, and then we'll talk about the organization you founded.
Sure. So I think, from where I'm sitting, having been part of the folks who responded in March of 2020 when the pandemic hit our shores and hit New York City pretty hard. Our hospital, New York Presbyterian Hospital, was really, really, on the front line of that work. And we were all called to action. We were all given many tutorials and many training sessions about a disease that no one really understood. And to be honest, we all still have some PTSD from that experience. And that I think is a whole nother conversation of that will probably be more of a therapy session for me, because it was a highly difficult, challenging experience for any physician in that moment. And so with that perspective, with that background, with that context in mind, for me, we are in a much, much better place. You know, our hospitals are no longer overflowing with COVID-19 patients. Our ICUs are no longer struggling, you know, with with the capacity of our ventilation and ventilator ability, capabilities and capacities. Um, our emergency rooms are no longer flooded with patients in their aisles. So for me, a sense of normalcy, at least within the health system, has returned. And I'm very happy about that. I do recognize that there's still a lot of work to be done. There's still a lot of infrastructure to be built, especially around pandemic response. I think that we really do need to look at our entire pandemic response approach and be more proactive and less reactive.
And do you think that it'll be possible for folks to become more proactive? Thanks to you, of course, you're working on that, but how do you think we're doing overall?
I think we're getting better, but I have to say, my optimism is tempered by my experiences, and now we see new threats, for example, like the MPX virus, the monkeypox virus, and I'm still concerned about our ability to deal with these, you know, these new threats from a public health perspective. So while I think that we're still processing the lessons and our experiences, I'm still concerned about our preparedness for future pandemics.
A word about monkeypox. People are, of course, getting worried about it. What can you tell us that people should know?
Well, I think that it's important to realize first and foremost that this is a disease that's contracted through skin-to-skin contact. It's not infectious in the same way COVID was infectious and aerosolized and airborne, and able to spread and diffuse through our societies at catastrophic rates. Monkeypox requires more direct, sustained contact, skin to skin with another individual. So I do not expect monkeypox to be the rampaging bonfire that COVID was. I'm hopeful that it can be contained, but again, we still see the struggle with vaccines, availability, and some of the issues that we saw during the early pandemic. But I want the public to be reassured that these are very different viruses with very different infectious rates, and I think we should all remain calm, because I do feel that we will get a handle on monkeypox and prevent a catastrophe.
There are so many devastating aspects of the pandemic when you look back on the last two and a half years. But one of them is definitely how communities of color were so badly ravaged by the pandemic. Can you talk about that? And that'll be a good lead in to the work of HHPH.
Yeah, thanks for that question. That's really what I'm most passionate about, are these communities that have been ravaged. But they haven't only been ravaged by the pandemic, Sree. They've been ravaged since these communities arrived on our shores in chains, and in the underbelly of slave ships. And so we can trace what's going on today to those slave codes, which morphed into black codes, which morphed into Jim Crow laws, which morphed into the current structural bias, implicit and explicit, that we continue to see in our communities. And as a result of these biases, communities of color have continued to be marginalized, disenfranchised, and it's within that milieu that disease and chronic diseases are born and are baked and are entrenched and become almost atmospheric within these communities. And so I think that is the context within which the communities to which I belong continue to be ravaged by whatever virus has been sneezed into society.
Yeah, we're looking at some of the comments. People are jumping in. Patricia says, thank you, Dr. Olajide, for your frontline services, especially during this time. She's grateful, and it seems like healthcare is now a top priority. We hope that that will continue to be the case. And Dr. Sujana Chandrasekhar, host of She's on Call, says, yes, 100%. This began in 1619, not in 2020. And that's an important perspective. We have folks watching from all over the world. Audrey is watching from Lansing, Michigan, and Eve from Charlotte, North Carolina, Harvinder from Chandigarh in India. And you can see there's global story that we've just all lived through. It just shows us how we're all connected. And when I talk to people about the work that you do and Hip Hop Public Health, they think this was something that was put together during the pandemic. And it certainly wasn't. And you've been working on these issues long before 2019.
Yes, Dougie Fresh and I started Hip Hop Public Health in 2005.
Amazing.
And I was still just a junior faculty member at Columbia at the time. This was something that Doug and I both really believed in. And we really recognized the power of music to really to impact communities within the healthcare space in a way that we felt that it had the potential of accomplishing. So through the work I've done with Doug, we were able to really do a tremendous amount of research. I'm a Columbia faculty member, and first and foremost, I'm a physician and a scientist. And so the approach that we took with Doug, really, for me, it was really important to have proof of efficacy to show that as we forage around within the music space, looking for that classical intervention that we hypothesized could really impact health and behavior. I wanted to make sure that we tested that rigorously, scientifically, to show proof of efficacy and show that our outcomes actually had meaning. And so Doug and I began this journey. Doug was wonderful in terms of his ability not only to contribute his talent, but also to recruit others into the Hip Hop Public Health family. Others like Chuck D, others like DMC from Run DMC, others like Ashanti, and others like Cheryl Salt James from Salt and Pepper, who's our most recent recruit. So Doug was able to work to pull together a coalition of incredible artists to help us on the entertainment side of our approach, because our approach really hovers around three pillars. The first is the artistic pillar, through which music and entertainment is leveraged. The second is the cultural pillar, which we believe is critically important for acceptance and connection to our communities. And the third is the scientific pillar, which is the proof of efficacy, which are the best practices, the studies that we do, whether qualitative or quantitative, the type of trials that we design, like our hybrid effectiveness implementation designs, the scientific piece coming together with our cultural piece and our artistic piece to really have an impact across all the major levels of behavioral influence. And those levels not just lie at the individual level, Sree. They also involve our the interpersonal level, which is our relationships with families and our closest friends and networks. It also involves the institutional level, the places we work, the places we go to school, the colleges, the churches, those institutions that shape our lives. And it also involves the community norms within which we exist. And obviously, as we began this conversation, it involves our policymakers and our ability to really influence our policymakers so that we have equitable policies that are fair and just.
Well, one of the questions that everybody will have is, that connection between hip hop and public health. And let's start at that beginning. How did you connect with Dougie Fresh?
Well, this is an interesting story, Sree, and it was really serendipitous. So I am a hip hop junkie. It's one of the few things that I am addicted to in life, besides my kids and my family, of course. But I am a hip hop junkie, and I've been listening to the folks that I am now working with since I was a young teenager when hip hop was born. And so for me, it's almost surreal that I grew up listening to the music of Chuck D and Public Enemy and Doug and Run DMC, and these were my icons, Sree, when I was growing up. When I was in dark places, I would put on Grandmaster Flash and the Furious Five. I would put on, Rebel Without a Pause by Chuck, and these are the folks that I'm now working with. So in my main life as a physician, I was running the electrophysiology lab at Harlem Hospital. Harlem Hospital is on 135th Street and Lenox Avenue. It's bang in the middle of Harlem, which is the mecca of African American culture. And I was running the electrophysiology lab. I was the electromyographer for the Harlem community. And this is just one of these tests that involves putting needles in patients and giving them small electric shocks. And so there was a gentleman in my waiting room, and he was sitting in my waiting room, and he was rapping and beatboxing at the same time outside my waiting room. And so as I was walking, towards the waiting room, I saw him alone in the waiting room, really absorbed and immersed in beatboxing and rapping. And so I said good morning, and I shook his hand, and I asked him, are you a famous rapper? You have incredible skills, because truly, Sree, his beatboxing skills were not that of an amateur on the streets. He was incredibly with his beatboxing skills. And he said to me, he goes, actually, I was famous once. And he goes, have you heard of Richie Rich? And I was like, yeah, Richie Rich, from Captain Rock, back in the late 80s, early 90s. I said, of course, Richie Rich was incredible. And he looked at me and goes, I'm Richie Rich. And it was an incredible moment. And we spoke about the group and the trajectory of the group and some of the great work that they did. And then I asked him, I said, by the way, who taught you how to beatbox? And Richie said, I learned from the master, from the creator. And I said, no. And he said, yeah. And we both knew we were talking about Dougie Fresh. And I was like, Dougie Fresh? And he said, yes. And I said, how do I meet him? He goes, well, Doug lives just up the block on 131st Street. And you can meet him, I can set up that meeting. And then I said, well, in addition to wanting to meet him because he's such an incredible talent and one of my icons, I'm also would like to meet him because I just started a program in Harlem around stroke. And this was the hip hop stroke program, Sree, that, I had just conceptualized along with the National Stroke Association. And I was looking for an artist to help produce the track for the song that we were trying to create to promote stroke literacy, which is recognizing the signs and symptoms of stroke and knowing what to do, and also recognizing that if you can get to the emergency room, at that time it was 3 hours, but it's now been expanded to 4.5 hours. If you can get to the emergency room within that time window, we can give you a medication. It was a clot-busting medication that could potentially reverse your symptoms and signs of stroke. In other words, Sree, we have had patients that have arrived in our emergency rooms with devastating weakness on one side, paralysis, inability to swallow, when they arrive within that critical time window and we give them this clot buster medications, their symptoms literally melt away over the ensuing days. We call that the Lazarus Phenomenon. And these patients recover and go back home to their families. But the problem at the time, Sree, was that we were treating at Harlem Hospital about less than 2% of patients with stroke because they were all arriving too late for this treatment. Beyond, they would call their pastor, they would sleep it off, they would think it's going to go away, and they were just missing that treatment window. And so we, working with the National Stroke Association, we asked the question, how do we get folks to recognize these symptoms as urgent? And the fact that we had this treatment available, but only available for that short window of time. And so I was looking for someone to create a song about this exact issue, to put the signs and symptoms of stroke in a rap song, along with what to do, and disseminate it through the school system to parents and grandparents in Harlem. And so I said to Richie Rich, I said, in addition to wanting to meet Doug because he's an incredible icon, I would also like to work with him on this project. And that, Sree, is how Hip Hop Public Health was born.
And that's the origin story, folks. You heard it right there. Two folks who would help change the way in which public health is understood, met there in Harlem as is appropriate. Here's Doug Levy saying the stroke video that Dr. Williams and Dougie Fresh did years ago has been one of the best examples of health communications I've ever seen. It's outstanding and unquestionably has saved lives. We have some highlight videos we want to show, and let's see if we can get this video in. We won't be able to play the whole thing, but just a little bit so that people can hear it, and then you can talk about it. So let's see if we can make that happen. Here we go.
Let me tell you something. Everywhere I look, they be doing it stroke. Uptown in Harlem, they be doing it stroke. Statue of Liberty, they doing it stroke. Kids, come join me and let's do it stroke. Come on. Stroke, stroke. Put your hands out. Stroke, stroke. Stroke.
So let's have you talk a little bit about this, please.
Sure. So this was really a video called Stroke Ain't No Joke. And the goal was to accomplish two things. One is get folks to recognize the symptom of stroke, especially kids, because our proximal targets were children, and our distal targets was their parents and grandparents. The concept was, could we use children, make them stroke literate, and empower them to teach their parents and grandparents those signs and symptoms of stroke, so that the parents and grandparents become stroke literate. The reason why we wanted to go through this approach was because the parents and grandparents of these children are incredibly at high risk for stroke because of the structural racism that we alluded to earlier, and the diseases that accrue in an environment that's that's really suffered at the hands of the system. But how do we reach parents and grandparents, right? And the way we reach parents and grandparents has always been a difficult thing for public health interventionalists. And the reason why is because parents, especially parents and grandparents, folks between the ages of just out of college or just out of high school and retirement, within these communities, these are the folks who are struggling. They're hustling. They're trying to make a living. They're trying to put food on the table. They're really, really struggling to survive and thrive. And these are the folks that really put health at the lowest priority on their list, because there's so many other pressing biological sustenance needs. And so it's been traditionally very difficult for public health to reach these folks within these communities. And so we hypothesized that children can reach their parents. I have children, Sree, you have children. We're all familiar with homework assignments during a certain age when we would come back exhausted from work and it would be, Daddy, I need your help with my homework. And so we hypothesized by embedding some of these public health strategies and messages and knowledge and learnings into those homework activities, that we could educate parents and also grandparents who sometimes are the primary caregivers of these children. And so we created a multimedia curriculum. This was one of the videos, but we also had another video, another animated video. We also had some comic books, and we also created a video game, all centered around communicating this information to parents and grandparents, and obviously the children themselves, because we built in what we call primordial prevention strategies for the children. In other words, smoking modules, healthy eating modules, healthy lifestyle modules. So the kids were also benefiting from those primordial prevention approaches, in addition to serving as conduits of stroke knowledge into their homes. And so we got the trial funded. We randomized about 3,000 plus children to receive the intervention versus an attentional control. And we were funded by the NIH to do this study. We recruited about over 1,000 parents were recruited into the trial. And we published in a major stroke journal, actually. And what we found, Sree, was that yes, our hypothesis was correct. That children not only could learn these lifestyle habits and behaviors in their own lives and implement them, but they could also serve as conduits to their parents and their grandparents. And we had a number of children who were calling 911, recognizing symptoms in their grandparents and their parents, which to me is just the greatest form of heroism, to want for a young 9-year-old to recognize stroke in his or her parent or grandparent and call 911, get that individual to the hospital to receive the thrombolytic, the clot buster treatment on time. Imagine that heroism. We had a number of children doing this. And we also had parents also calling 911 and recognizing these symptoms who wouldn't otherwise have recognized the symptoms. And so we published our reports. And Doug and I, when we spoke about this, we said, you know what? This is not about stroke. This is a model that we can apply to almost any public health issue that we're confronted with. And that is how the organization began to evolve.
I'm so glad to hear that story, for everyone to understand that. Here's Miriam saying your creation of the stroke video was a stroke of genius. And Dr. Sujana Chandrasekhar says, stroke care is truly miraculous now. It is amazing how you merged outreach music and enabled people to manage their own health. You're absolutely right, Sujana. Thank you. There's a good opportunity for us to do a little bit of teaching ourselves and reminding folks, FAST, which we saw multiple times in that video, face, arms, speech, and time. If you can give us the very quick signs for folks to know, if they haven't watched the hip hop video yet, they can learn from you.
Sure. So the F is, so the FAST acronym is really demonstrate the signs and symptoms of stroke. So the F is for the face. The face droops down on one side, could be a sign and symptom of a stroke. The A is for the arm. If your arm drifts down, or if you're just unable to lift up your arm because it's weak, that could be a sign of stroke. And
when you try to raise both arms, but one
so lift both arms up, and if you can't raise both arms, and one is weak or paralyzed, then that's a sign of stroke. If one just drifts down, that could be a sign of stroke. And it could be the leg as well, trying to lift up both legs, and one is difficult. And then S is for speech. If your speech is slurred, if it's garbled, if it's nonsensical and incoherent, that could be a sign of stroke. And T is an action item, which it stands for time, which means it's time to call 911.
And also you want folks to note the time, because you said it's all about a window of time. Right now it's 4.5 hours. It's
critically important to know when the symptoms began, ballpark, when did those symptoms begin, because the clock starts to tick from the moment of the first symptom. And we can now treat individuals within 4.5 hours with the clot busting medications, and within 6 hours with a procedural intervention that involves extracting the clot directly from the brain. And in a very small subset of patients, we can even extend that out to 24 hours. But that is a very small subset of patients using some sophisticated imaging techniques to identify that small set of patients. But one of the overarching themes across all of these opportunities is the fact that time is brain. Every minute a stroke is allowed to continue, Sree, we lose about 2 million of our brain cells. Imagine we have about 20 billion in our forebrains. If you're losing 2 million a minute, there's no wonder that we're left with disability following stroke.
Thank you for everyone who's reacting to this. Here's Dr. Lippy Roy says, kudos, Dr. Williams. Direct community outreach, especially those disproportionately impacted by heart disease and stroke, can be life-saving. Great example of intersectional partnership, medicine, music, entertainment, etc. And Pradnya Haldipur, who has been a guest on the show in the past, is watching, and she says she's heading over to LinkedIn to share with her medical networks. And she's also doing this. She's tagging folks. All you have to do is tag a friend who can watch now or later, and that will be a really good thing that you can do right now. So let's fast forward a little bit to the work of Hip Hop Public Health. We're going to show the website and then show some highlights. And here it is. We are Hip Hop Public Health, building health equity through the transformative power of music, art, culture, and science. So talk a little bit about the work you do, and we'd love everyone to go to hhph.org. You can support their work by spreading the word. You can make a donation. This is such important, timely work that they're doing.
So, Sree, music for me is a bridge between health education and our streets, and I'm talking about the inner city streets. To me, music really has untapped potential. If you think about music, if you think about the effect of music on your own emotions, when you're listening to a song, how it makes you feel, how certain songs can soothe you, certain songs can inspire you. Just think of the Rocky III anthem when you're going for a run in Central Park, or how a certain song can even make you cry. You know, music has incredibly powerful effect on our affects, which is our emotions. But what people don't also know, but they know but don't know, is that music is also an incredible learning tool. Think about how we learn our ABCs. We learn it through song, right? Think about music memory, how you remember exactly what you were doing, but when you heard a particular song within the context of love, right? So think about the power music has over our memories, the power music has over our learning. We now know from a neuroscience perspective that music augments learning, music augments memory, augments retention, in addition to its benefits on emotional arousement or emotional depression. And so music, it has this untapped cognitive power, in our opinion. And the goal of Hip Hop Public Health was to take this transformative power of music and then build it into our model that engages culture and science as a public health intervention for a whole variety of conditions. And we've applied it to COVID, to Alzheimer's dementia, to stroke, as you just saw, because we believe that music really is a vehicle that can help us within communities of color that struggle with trusting information, that struggle with trusting healthcare systems. They love music and they love certain artists. Certain artists have credibility. You know, I've always said whenever I give talks, Sree, that credibility is the cornerstone of persuasion. And who better to persuade individuals than people that they find credible? And a lot of young people in our communities, hip hop is a credible part of their life. It's a culture. It's the place that they seek solace and comfort. It's a place that inspires and engages. And to take that hip hop culture across all of its 5 pillars, by the way, hip hop is just not music. Hip hop has 5 pillars. To take the culture of hip hop and weave it into public health interventions, we have shown proof of concept with our stroke program that we have shown that this has incredible ability to influence the learning, the health knowledge and health learnings in these communities, but also, Sree, that learning translates into behavior change within these communities. And so that is how Hip Hop Public Health was born. That is what we have been doing. We've been using the transformative power of music around issues relevant to health equity, using children as the primary conduits into their homes and effecting change from the ground up.
Amazing. We're looking at the website. Here's the section on what we do, and we'll also see the team that you have put together. So talk about the folks there. We see you and Dougie Fresh. Talk about Lori.
Oh my God! So Lori is she's the CEO of Hip Hop Public Health and a tremendous public health leader in her own right. I have to tell you this story about how I met Lori because I think it's so serendipitous. My life, Sree, has been blessed with so much serendipity. I met Lori on NPR. I was invited to talk about the crisis of childhood obesity on NPR, and Lori happened to have also been invited to talk because at the time she was running the Office of School Wellness at the Department of Education. And so she was representing the local government, and I was really representing the work that we had been doing in the space at Hip Hop Public Health. So that's how Lori and I met. We met at NPR live on a show. And then I remember saying to myself, I have to meet this woman. And so I sent her an email and I asked her for an appointment to meet with her. So I went down to DOE, to her office. We had a wonderful meeting, and since then we became she became a thought leader, an advisor to Hip Hop Public Health for many years, and then when the opportunity came for her to lead Hip Hop Public Health as CEO, I remember having a very roundabout conversation with her that was designed to get her to say, I'm interested in this position. Fortunately, she did say she was interested in the position, and Lori was hired. And since she came on board, Sree, we've had tremendous growth, both from a partnership perspective, from an infrastructural perspective, but also from an impact perspective. And she's running an incredible team of folks at our office downtown on Wall Street.
Fantastic, and she's an awesome person to work with, so we know she's watching. Hi, Lori, and thank you for making sure we were able to get Dr. Williams on our show. Ron Thomas is watching from the JFK tarmac, waiting for landing gate. He usually lives in Dubai, and he is a fantastic person and someone who's doing really important cross-cultural work, cross-continental work. Folks, this is our conversation with Jide Williams, Dr. Jide Williams, who is the founder of Hip Hop Public Health. And we've been talking to him about various aspects of the current crisis and where we go from here. And we're going to now show you some highlights of the work that Hip Hop Public Health is doing after Neil reads a couple of comments, and then we're going to get to the newspaper.
There were just a couple of comments, Sree, that I want to make sure we brought in. We're not getting people's names and pictures, so I did a little research. Patrice Webb from Hip Hop Public Health is watching, and she was just adding that music is the great unifier. It's an authentic exchange between hearts and minds. So thank you, Patrice, for watching and all of your support in helping pull this show together. I also want to bring in a comment from our very good friend, Sonny Slaughter. Jide, you talked about how the health disparities that we're seeing now is the legacy of slavery going back to 1619. Sonny Slaughter was our guest on a very special edition of the New York Times Read Along, where we looked at the 1619 Project when it first came out from Nicole Hannah-Jones. She actually says she'd like to see the American Public Health Association Black Caucus of Health Workers collaborate with HHPH. She's a member there. So I'd love to be able to put the two of you together after this show. And speaking of collaboration, Pradnya Haldapur, another friend of the show and a former guest, wants to talk about health equity and climate change. So we're seeing that this conversation is, just sowing the seeds for a lot of great work out there. So thank you very much. As Sree mentioned, we have a highlights video that we want to show about the work. Again, it's a short video. I think we can play it through. It'll be a little snippets of the stroke video, but also your COVID work, little sugar, and I think wash our hands is in there as well. Let's check it out.
Don't sound right, then he's doing the show. Sway when he walks, then he's doing the show. Slur when he talk, then he's doing the show. Call 911, cause it ain't no joke. Now X for the face, and A for the arms, X is for the speech, and T is for the time. Time to do what? Call 911. Time to do what? Call 911.
Let's talk about salt, baby. Let's talk about MSG. Let's talk about all the good things and the bad things that we eat. Let's talk about salt. Let's talk about salt. Let's talk about salt. Let's talk about salt.
I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We could get back to normal, let me inform you, let's all get the vaccine. It's about community immunity, I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine.
Wash your hands, everybody, and everybody, wash your hands.
20 seconds.
Come on, wash your hands, everybody, and everybody. Wash your hands. My people uptown, wash your hands. My people downtown, wash your hands. People from the East Coast, wash your hands. People from the West Coast, wash your hands.
I suggest you talk to your family, your inner circle, and screaming and proactive, and it won't hurt you. We all want to live our lives the best we could be. Go check your colon. Peace, I'm Chuck D. Save lives, and peep the deeper meaning. Stand up to cancer and get a screening. Save lives, take control of your health. Get knowledge for yourself, and it's the real wealth.
I've been hiding in the shadows from the kids and all the babies. It's amazing, they go crazy, and the kids will always play me in the salad dressing, ice cream, and the muffins too. You can choose any topping, and I'm there for you. Get your burgers and fries from Burgerland. I'm the villain that's hiding in the soda can. Hide and seek, he's the fool, I made a fool of you. It's true, I'm very proud of what I do to you. I got 99 names and little sugar's just one.
What a range. And Jide, I think there are other videos that you star in as well that didn't make it into the highlight reel. We need to talk to whoever put that together.
Well, I think whoever put that together is fantastic. I applaud you because the videos with me rapping are very embarrassing.
So John and Lori and Patrice followed your wishes on that when they put that together, I'm sure.
Here's Dr. Lippy Roy saying, watching with tremendous amazement from Manhattan, which is lovely thought from Dr. Roy. So folks, please check out hhph.org. They are doing amazing work, and you can support them by spreading the word, making a donation, thinking about partnerships, and they have a gala coming up in October. Doc, you want to talk about that?
Yes. So every year we try to celebrate those who have really supported our work, and this year we have a gala on the 25th of October. Our entire artist advisory board will be there. Dougie Fresh, Chuck D, DMC from Run DMC, Ashanti, Salt from Salt and Pepper. We'll also have some of our incredible kids ambassadors, and they're celebrating with us. And the idea of the gala is not only to showcase some of our new work and some of our up and coming new work, and we have some incredible things to reveal at the gala, work that we will be unveiling going forward. But also to celebrate what we have gone through as a team, as a group, as a country, as a people, and the small role that we have tried to play on this journey. So the gala is going to be at the Harvard Club. The Harvard Club is the home of our gala, and please join us. Go to our website, hhph.org. And buy tickets, buy tables, support our work, join us. It really is a one-of-a-kind public health gala. We will have a fire chat with our artists at the gala as well. We'll talk about issues around health equity, around mental health, which we know is really our new focus going forward, given the times that we live in. So please support us. Please join us if you can. It promises to be really an incredible celebration.
Some of the biggest names in hip hop will be there. So folks, please tell your friends. You can go to just hhph.org and there's a gala button right there. And that's in October in New York City. So we've been talking about the work that you've been doing. We'll come back to that in a few minutes after we look at the New York Times. Folks, this is the New York Times Read Along. Every Sunday at 8:30 a.m. Eastern, we have a terrific guest, as we do today with Dr. Williams. We talk about the news and the newspaper, and it's a chance to focus on what's happening in our world. And Dr. Jide will read along with us. He'll comment on things that he finds interesting. So let's look at the lead story in the Times today. Is about in chaotic exit, Trump delayed sorting records. And we're seeing the impact of that story and the FBI raid of Mar-a-Lago. And this story, Dr. Williams, I really want to hear your thoughts on how in Odessa, in Ukraine, young Ukrainians are using dance and music to send a message about what has been lost because of Russia's invasion.
Yeah, no, it's anytime I hear about the war, any war, anywhere in the world, Sree, I always think about the children. I always think about the children because the trauma that these children are experiencing, Sree, people don't realize that trauma during childhood has long-lasting life effects on your physical health, not just your mental health, but also your physical health. And so, perhaps we can talk about that. But I think as we think of Odessa and we think of what they're going through and the heroism, we should also remember that we really have to talk about how to support their mental health in a time of true difficulty.
And we're seeing that, of course, mental health is a big issue, especially as we're getting ready for back to school time here in New York. And I know you've been advocating for better mental health resources and help. Here's another traumatic story. Migrants being just sent from Texas, put on a bus and sent to New York and other cities.
Yeah, again, this again, for me, with all of this politics that goes on, Sree, we always tend to forget the stories, the human stories that embedded within this politics and these migrants and their stories and the journey of fleeing, dangerous situations and situations of desperation, and then being put into this political quagmire. We forget the effect and the impact that it's having on these migrants and their mental health and the mental health of their families and their children. And so we must always remember the stories, the stories of these real individuals, and not allow the politics of the moment to eclipse the stories of real pain and suffering.
Here's another political story. The American dream is being now used as a source of division, where Republicans are saying that the American dream is in danger because of unchecked immigration, burdensome government regulations, liberal social policies, etc. You're someone who has lived the American dream. It's must be so sad to see this.
Well, I think that's a direct assault on people like me, who I consider myself an American. I'm an American citizen. I am part of the American dream. I believe, and I'd like to think, that I've contributed to American society in a positive way. I'd like to believe that I have contributed to increasing the ability for more Americans to be able to share that dream. And so for me, I think it's not just divisive. I think it's dangerous. And frankly, I think it's racist.
Well said, Doc. Thank you so much. Being direct is so important in this. Here's a different kind of story, also a sign of the times. People are flooding to a game called Pickleball, which is kind of part ping pong, part tennis, part badminton. And because they're older folks, they're ending up in the ER. I know you think it's good that at least this shows people are trying to get exercise, right?
Yeah, but exercise has to be age appropriate and physical ability appropriate. And I think that if you are not used to vigorous interactive sports, I think you need to be careful with how you are introduced and how you engage initially, especially if you're an older person. Otherwise, what we will end up seeing are a bunch of herniated discs, muscle strains, muscle pulls, and it's exactly what I believe this article is talking about of older folks engaging in this sport ending up with these conditions. So it's important for us to engage in age-appropriate exercise. And when we want to engage in more vigorous sports, I think we need to do it in a graded manner so that our bodies are conditioned and ready to engage in higher level sports.
I love that analysis. Thank you. Here's a story about another form of art, in this case, the entertainment world, the world of movies and TV. The great Michael K. Williams, who played Omar in The Wire, devoted himself to making Brooklyn's black communities safer. So if you can talk again a little bit about how art plays a role and the arts play a role in this.
Rest in peace to Michael Williams. He was a great actor, from Omar in The Wire to Boardwalk Empire to his role in so many incredible movies. But his tragic death reminds us again about mental health and about the importance of focusing on mental health. And I think that, for me, addiction and overdose and are issues that directly tie with mental health at its very core. And I believe his life and legacy has been used so positively to address the current wave of mental health that's really percolating through Black communities. And so I'm a big fan of Michael Williams's work, and I'm also a big fan of his posthumous work, as we can see here.
That's great. Here's a headline from history, Dr. Williams. Today in 1964, Lyndon B. Johnson declared an unconditional war on poverty. In his first State of the Union speech, signed a sweeping almost $1 billion anti-poverty bill. And of course, we have seen some progress, but it's still, in our communities of color especially, there's still so much pain.
Yeah. Very quickly, Sree, I think the issue of poverty is critically important. And one also has to recognize that poverty impacts brain development. And I say that again, poverty impacts brain development. A recent study really looked at this quite rigorously and showed the impact of poverty reduction on an infant brain activity. Very quickly, they took 1,000 women from Minneapolis who were poor and desperate, and they randomized them to receive a check of $333 versus a check of $20. And these were mothers who had just had babies, and they did what we call EEGs, which is an electroencephalogram. It's a test that we do to look at your brain development, and the EEG has patterns that you can correlate to neurodevelopment of the brain. And what they found is that in those who received the higher amount, the $333 a month, versus those who received the $20 a month, the neurodevelopment based on this EEG of their infants, and this is controlling for all the usual suspects, controlling for everything else, they found that the neurodevelopmental patterns of the babies, the infants, whose mothers received the higher amount, was normal and much more robust relative to those whose mothers received the $20. And we have repeated these types of studies over and over again, showing the relationship between the suffering of poverty and the neurodevelopment of our babies.
So important. Thank you, Doc, for sharing that with us. We're looking at the inside of the New York Times. Here's a story that shows how things can change. Here is the new FDA rule that clears the way for hearing aids to be sold over the counter, no exam or prescription needed. The change, which is likely to make the devices less expensive and more innovative, carries promise for roughly 30 million Americans who are experiencing hearing loss.
I think it's, we also have to talk about health disparities here and access disparities. And the truth of the matter is there's a segment of our society that has very poor access to any hearing aid, whether it's the cost-related access or whether it's just a physical infrastructural barrier to access. And anything that we can do to remove the barriers to access in hearing aids or make them cheaper, so that more individuals can have access to this, is a good thing that not only benefits the entire society, but especially helps those from our more disadvantaged areas.
There are two stories this week that caught my eye, medical stories about this, where things are being made more accessible. One is this story about, that you can now you will be able to bypass a prescription to get a hearing aid. The other is about hair growth. And you may have seen the story that dermatologists are recommending that you take something that's in Rogaine, which is a very famous drug, but if you take it orally, it works better and is cheaper than being applied to your hair. It's too late for me now, but it just shows you that innovation is possible. Not just, you don't have to invent new technology. Can you make things that are available more available?
You hit the nail on the head. I think that the answers are already in our society, in our institutions, in our hearts and minds. The problem is access to these solutions. And often that access to these solutions has so many layers that we need to unpack, ranging from the structural racism related issues all the way through to issues around cost and innovation. And so I think you hit a real nail on the head that there is existing opportunity to take what the solutions we already have and know about and making them more accessible and more equitable, quite frankly. Because I think that for me, the cancer in American society has to be the inequity in American society. And I use the word cancer deliberately because as a physician, I have watched cancers spread and metastasize all over the body until that individual really transitions beyond just suffering. And I know from the history books that the greatest societies aren't defeated by external forces often, they implode from within. And cancer is what makes the human body implode from within. And I truly believe that unless we address the cancer of inequity in our American society, it will metastasize to all types of areas and places and spaces beyond the ability for us to treat and eradicate it. And we are running an existential risk of imploding from within.
Dr. Sujana Chandrasekhar says, yay, FDA, but I strongly recommend ENT exam and proper hearing test. Remember, Medicaid covers hearing aids still. So it shows you the value of having, of course, professionals check your hearing. Folks, this is our conversation with Dr. Olajide Williams, Jide Williams. He is the founder of Hip Hop Public Health, HHPH.org. Check out their amazing work. We're reading the newspaper with him, and here I saw how a sleep scientist prepares for sleep. Among the things she does, keeps her space cool, clean, and comfortable. She keeps her phone away from the bed. She removes the dog from the bedroom. She makes sleep a priority. She knows what works for and against her sleep. She says working late, for example, is something that she does. What do you do, Doc, to try to get your proper rest?
So
I don't know when you sleep, by the way. I don't know if
I'm
you
going to
sleep.
share a secret with you, Sree.
Yeah.
So the question I always get is, Jide, do you sleep? How do you sleep?
Yeah.
You're doing all of these things. How do you sleep? And when I respond, people are always shocked. The truth of the matter is, Sree, I sleep 7 to 8 hours every single night. And I still do all the things that I do. And the reason why is because I make it a priority to prioritize sleep. A lot of people don't know that sleep is not only the cousin of death, and I mean lack of sleep is the cousin of death, but it also good, healthy sleep hygiene promotes life. And we know from studies, numerous studies, that people who are getting less than 6 hours of sleep, and again, this is just the studies, not me judging or criticizing anyone, but people who get less than 6 hours of sleep are at higher odds of getting heart disease and stroke. And so sleep hygiene is critically important, and getting 7 to 8, however difficult and complicated your life is, will prolong your life. And so, as I always say to folks, if I can do it, then we can all do it, because sleep is a life-sustaining, life-promoting activity, and it's free. But often, the barriers to sleep often go unchecked to the extent that we don't even know how to get a good night's sleep. And that's where the health professionals come in, because if you do have trouble sleeping, there are what we call sleep experts now. It's a whole specialty of medicine that has blossomed over the last couple of decades. Sleep experts, please seek one out, because sleep is critically important to your well-being and joy.
I think you're making a lot of people jealous because you're able to do all of this and get your sleep. And Neil says, dang, I need to get more sleep, more consistent sleep. And Diana says, prioritizing sleep is so important. I never valued it till lately. I'm working on getting more than 5 hours now. I'm a poor example, but working on it. Doug says, I am happy if I sleep 4 hours. Even if I try to sleep longer, it rarely happens. Though I still say that I sleep so much better than when I've been to the gym or otherwise active during the day. So I'm glad we were able to discuss sleep in there as well. Folks, we're just looking at headlines in the newspaper. We won't have time to get into all these stories. More agony for survivor as India lets rapists go. Fatal shooting of prominent wildlife defender may signal an escalation. Concerns that crime syndicates may be growing more brazen. And this is about South Africa. And Orban, scourge of liberals, faces a new foe, economics. That's about what's happening in Hungary. Story on Mexico about the forced disappearance of 43 students. Just how do you deal with the news? And some of it is so disheartening and upsetting. How do you deal with it, Doc?
That's a great question. And this is some of the things that affect people's ability to get a good night's sleep. And so for me is I try to only deal with the news on a much more cerebral, low impact way. What I mean by that is I don't embed myself. You know, some people are just immerse themselves religiously almost in the news to the detriment of their own health. And we all have to recognize that things affect us, and we assimilate things sometimes unconsciously, sometimes subconsciously, and they affect us and they spill over into our ability to sleep. And so I think it's very important for all of us to think about how we process news and how much news we actually need and how much news that we don't need, rather than being almost mindless about consuming news. We need to be more mindful in how we consume news. And I think mindfulness news consumption is an important, is an important thing that I think we all need to engage in to preserve our mental health.
Thank you, Doc. So important. And speaking of upsetting news, we saw, of course, the attack on Salman Rushdie. He is recovering. Voicing Rushdie's words to defend free speech and hope for his recovery. This was a protest in New York, a vigil, support of Salman Rushdie. And we're looking at the obituaries here. Jean LaBelle, judo champion turned Hollywood stuntman, is dead. Cecile Pineda, who's an author known for Novel of Identity, has passed. Reverend Carl Kabat, peace activist and avowed fool for Christ, dies. Ann McGuinness, 65, major fundraiser for women's health and abortion rights. She's raised hundreds of millions of dollars for reproductive rights and justice. Can you use this opportunity, Doc, to talk for a moment about the changes happening in reproductive rights right now?
Well, I mean, I was devastated by the decision of the Supreme Court. I think it has set us back hundreds of years. I think there is a racial justice issue in this as well that we need to recognize, and that is that the people at the most disadvantaged end of our spectrum are the ones that are going to die the most as a result of this ruling and decision. And so I think it's a dangerous precedent for the healthcare system. And I think that the ripple effect has already begun, and I think will continue in a lot of states that end up enacting and enforcing this. So for me, Sree, I think it was a sad day. I think it was a traumatic day for the healthcare system, and I think that we are still we're still going to there's still a lot to come on this issue that I am very, very nervous about from a public health perspective.
If there's somebody watching who thinks this is not an issue that affects them directly, what is your message?
I think it is. It's an issue that affects all of us, and I think that to think that it doesn't is not being realistic. And ultimately, I think that if we are interconnected, Sree, and one thing COVID taught us is just how interconnected we are. If you just think about the Upper East Side of Manhattan, and you think about Spanish Harlem above 96th Street on Manhattan, these are two separate communities who traditionally don't really have much interaction with each other, or don't really believe that what happens in the Upper East Side affects what happens in Spanish Harlem. But the truth of the matter is, when COVID hit, and it became, the COVID rates were much higher in the Spanish Harlem above 96th Street. It threatened what was going on in their neighbor, the Upper East Side, and we see this across all of these types of issues, where we falsely believe that we are isolated in the bubble that's not going to be penetrable. But the reality is that we are much more interconnected than we realize across the entire spectrum of these types of issues. And I think the same will apply in this case. When we start to see the impact in our communities directly traceable to this issue, we will realize that its impact ripples beyond the walls of the shores of the individuals we think are going to be the most impacted. It's going to affect all of us.
Thank you, Doc. We're racing through the paper here because our conversation is so interesting. We won't get to all the sections in the paper. Here's Therese Steiner says, thank you for channeling the power of music to raise awareness of critical health issues and the structural racism impacting access to health care in and for communities of color. And folks, check out the work that his organization, HHPH.org, Hip Hop Public Health, is doing to learn more about this. Here's a story from the cover of the Sunday Business, how a CEO used viral fame as a lure. He's somebody who advocated, Dan Price advocated, he's an obscure company, advocated for a $70,000 minimum salary for everyone in his company, became really famous, but then used that fame to assault and attack women. He was trying to do something good, right? Like to help improve equity within his company, but then fell into this situation, which he's responsible for, of course. The Sunday New York Times opinion cover is all about fun. What is it? Can I have it? Will we ever have it again? What do you do for fun when you spend so much of your day dealing with such difficult issues?
It's a great question. I think that I one of the things I always tell my children is that happiness and joy really doesn't come from the things that we have, the things that we own, our status, our position in life, that it comes from something far deeper. The relationships we have with ourselves and the relationship we have with others. But the relationship has to begin with ourselves and then the relationship with others. And I think that if you realize just how much joy you can derive from your internal relationships, as well as your relationship with your friends and your family, that's really where the joy and the happiness, it's really in those relationships with ourselves and with our loved ones. And as long as we harness those relationships and honor those relationships and uplift those relationships, I think we'll all find the type of joy and peace and fun that the article is talking about.
Thank you, Doc. Just some examples. Here is the founder of Natural Pursuits, a queer nudist community in Brooklyn, and then kind of the opposite of that, people all dressed up with armor for costume gladiators practicing fencing in Central Park. If you get the wrong invitation and you go to the other place and you're wearing the wrong attire, you could get in trouble. So this is, here's also an unusual headline: "If only my girls knew the joy of a landline." Now, we have kids who are of the same age group. Are there things that you try to explain to your kids, and they just don't get?
Well, honestly, I don't get half of the world that my kids live in. I just go with it, Sree. I just go with it. But I do discuss the mental health effects of social media with them. I do talk about, obsessiveness and social media addiction and its effect on anxiety levels. And we have those conversations, but they are really growing up in a different world. And I think that the rules and the norms of that world is very different to what we've grown up in. And I think over time, we will reach, hopefully, some sense of balance that works for, their own thriving and their own success.
Thank you, Doc. We're looking at the social cues column by Philip Gallanz. It's a etiquette column, and he's been writing it for 14 years. There's an article in the paper interviewing him about his 14 years writing this. So we're going to do something fun here. I'm just going to read a question here, and there's no right or wrong answer. I just want to hear your thoughts. So it says, "A colleague from 3 jobs ago is visiting my town next month. She wants to get together. I don't. There's nothing wrong with her. I just don't care for her. I'm tempted to ignore her email, but I know she'll follow up. I don't want to be rude, but I also don't want to travel for an hour after work to meet her, chit chat for 2 hours, spend $40 on dinner, then travel home again. What would you do?"
Well, usually my answer is I'm protected by my profession. And a doctor always, a doctor's busy life and patient schedule is always a wonderful excuse in these situations that doesn't harm or hurt the feelings of the other person.
Yeah, the rest of us don't have that. Yeah, so here's Philip's answer. "Try not to make a federal case of this. It's just a friendly invitation. Respond, I hope you have a great trip, but your travel dates don't work for me. The end." So that's a really good way to respond to that. And here we're seeing, in one of the great things that has changed over time, as we look at the wedding section, how many people of color are there, how many same-sex marriages are in this, and same-sex weddings. It's just great to see how things change, even as we talk about things not changing. So we just have a few more minutes left. I just wanted to look at the book section and say, do you have time to read?
Not only do I have time to read, I'm actually writing my own memoir right now. So yes, I do enjoy reading, and I do enjoy writing. I've always written throughout my life, and I've always really enjoyed literature. I like getting lost. You asked earlier what I do for fun, and for me, reading and getting lost in these beautiful, imaginative worlds is a great outlet for me.
Yeah, and the cover of the book review is "Love and Empire: Afterlives," the new novel from the Nobel laureate Abdul Razak Gurna is a big, bold, richly drawn novel of East Africa. And speaking of the continent, we should give people a little bit of your backstory if we can. I know it's a rich and deep story, but let's get the short version.
So I was born in Lagos, Nigeria. And actually, my father delivered me in my mother's Volkswagen Beetle because I decided on Christmas Eve that it was time to announce myself. So I popped out as she was parking the car in the garage of our home in Lagos, and my father ran to the scene. Thank God he's a doctor. He actually trained at St. Mary's Hospital in England and Johns Hopkins here in the United States. So he was able to deliver me, but when I listened to the stories, it was pure pandemonium and panic. And he didn't believe that he could deliver me at the time. So, and then I spent my first 9 years in Nigeria. And then I was sent to boarding school in England. And I was in boarding school from the age of 9 to the age of 19 when I returned to Nigeria for medical school. From medical school in Nigeria, I went back to England, I was in England for about a year or so. I call that a transitional year to the United States. And then I moved to the United States and I moved to, I actually got a job at Harlem Hospital where I began my career as a physician. I did practice after I graduated for a couple of years in Nigeria before I moved to England and then to New York. And then I basically came straight from my residency here at Harlem Hospital. And then I did my internship at Harlem and did my residency at Columbia University. I was retained on the faculty at Columbia University, where I've been ever since. I also run, I'm also part of a family organization in honor of my father who passed 5 years ago, called the Gabby Williams Alzheimer's Foundation, that really delivers interventions and training opportunities on the ground in Lagos, Nigeria, really fighting the kind of the stigma of Alzheimer's disease and the poor infrastructure as it relates to dementia. And so I still go back and forth between here in Nigeria, and I also still have presence in England because a lot of my family members, some of them are in England, some of them in Nigeria, and so I still go back and forth between the three continents. I kind of feel like a third culture child, Sree. I feel part Nigerian, part English, and part American. But again, I think that the whole world is getting so much smaller that we're all eventually going to become third culture children.
I love that. The last story we're going to look at is a cover of the New York Times Magazine is about Willie Nelson turning 89 years old. And I was curious about how you think that music of all kinds can be helpful in the kind of work you're doing.
I think Patrice summed it up. I really do. I think music is the great unifier. Before language, there was music. Even in Hollywood, before words on the screen, there was music on the screen. And so music is the great unifier. I think it can heal. I think it can transform. I think it can edify. I think it's transcendent. And I think that the future must include our attention to these beautiful and scientifically powerful attributes of music.
And that was Patrice's comment that got that started. So thank you very much. What we're going to do, Dr. Williams, is we're going to give you a couple of minutes to just catch your breath while we do some housekeeping. And then when we come back, we're going to do two things. We're going to hear you talk a little bit more about HHPH and also the gala that's coming up. And we also want to ask you for a pro tip for writers and journalists who are covering medical issues or health issues. What is something that you want every journalist and every writer to know? I think that will help a lot of folks. So we'll give you a moment, and Neil's going to come back and say hi.
Hi,
Neil.
Sree.
What a great episode. I learned so much from Dr. Jide Williams. I hope everyone will check out the work that they're doing at hhph.org.
Absolutely, and watching those videos, I actually watched some of those videos with Emily yesterday. She enjoyed it. She was getting into it. So they really are doing some powerful work and getting through to people, cutting through the noise out there. We want to make a few quick announcements before we wrap up. First, excuse me. I want to remind people that the show is produced by Digimentors, the consulting firm that Sree set up. We produce hybrid and virtual events. We also do social and digital consulting, trainings and workshops. So if you're interested, please reach out to us. We'd love to work with you. You can reach Sree at Digimentors.group, or myself, Neil at Digimentors.group. Send us an email. We'd love to work with you to help produce a hybrid event, or do some a training or workshop, social media audit. We do recruitment and more. We also want to give a big shout out to our team. You see Sree and I on screen, and we engage in the conversation, but behind the scenes is Paula Kiger, who is sharing links, engaging with the audience on Facebook and LinkedIn, on Sree's Facebook and LinkedIn. And I'd like to take a moment, Sree, just to offer our condolences to Paula. I know she lost her father this last week, and it's been a very challenging week. But even though we encouraged her not to produce the show last week or this week, she still insisted, because this is a family and we enjoy each other's company. She loves what she does. Paula, thank you very much. Our hearts and thoughts are going out to you and your family.
Thank you, Paula. You're just amazing, above and beyond every week already, and now here you are with this, and we're thinking of you and your family.
Absolutely. And we also want to give a shout out to Muck Rack, our sponsor, longtime sponsor for Sree's Sunday New York Times Read Along. If you're interested in being a sponsor, you can join us. You can email us rather at the same email addresses: Sree at Digimentors.group and Neil at Digimentors.group. We also want to give a shout out to the Local Connection. The Center for Cooperative Media at Montclair State University brings you the Local Connection newsletter each week. It offers story ideas and pro tips. That's where Dr. Jide's pro tip will end up eventually. And best of all, it's free. You can subscribe at bit.ly/local news tips, bit.ly/local news tips. And before we bring Jide on, Sree, I want to share next week's guest. He's a guest, but we're actually going to be doing something very different next week. David Dunlap, who is the historian at the New York Times and the lead curator for the New York Times Museum, will be our guest. And we are just thrilled at this opportunity. He's going to give us a tour of the museum, which is only open by invitation. Sree will be there with him. It's going to be an incredible opportunity to see all the great exhibits they have. So please join us August 28th at 8:30 a.m. Eastern Time. And with that, we'll bring back Dr. Olajide Williams. Jide, thank you so much for joining us. We really appreciated it.
Thank you, Jide. We're getting such great comments from everybody, and we want to just ask you to tell us a little bit more about Hip Hop Public Health and about your big gala coming up.
So I just want to just thank you, Sree, for having me. This has been such a wonderful conversation. Just one thing I want to emphasize about Hip Hop Public Health is that we really focus on communities of color. We really focus on the communities with the greatest need. That's how we triage our resources. That's how we decide the type of programs that we develop. And I want to just emphasize that all our resources are free. All our resources are provided at no cost, completely free to our constituents, to our communities. And that is why the gala is so important, Sree, because the gala is the one opportunity to really raise support in terms of partnership and financial support for our programming, for the work that we've done. You could see the work that we did with COVID-19. It was so impactful. It reached so many people in these communities. It changed lives. We believe it helped drive the uptick in vaccination rates. But all our resources are free. We have hundreds of resources on our site. You just have to go to the resource page on our website to really see the types of resources that are available. Anyone, anywhere in the world can download our resources for free. We are true believers in equity, and we are true believers in removing any barrier to inequity, and we begin with ourselves. And so please help us. Please support us. We would love to have you in person at the gala, but if not, we would love for you to support the type of work that we do so that we can expand and scale our impact. And Sree, what else did you want me to mention?
Well, just want to just look at all these stars that are going to be there. I think this is fantastic.
Yes, yes, and they're our family, Sree, as you know. These folks they're not in it for the money. They're not in it because we're paying them. They're in it because they believe in our mission, and they believe that music and entertainment can help and advance our public health goals within our communities of color.
Look at these names: Dougie Fresh, Ashanti, Chuck D, Daryl DMC McDaniels from Run DMC, and Cheryl Salt James from Salt and Pepper. What a great lineup it will be. Last thought before we let you go: anything that you would love, you wish that every journalist who is covering public health, covering the crises around us knew?
So the only thing I would say is, first of all, to thank all the journalists who have covered the story objectively, to thank all the journalists who have stayed away from, propagating misinformation and disinformation, those who have stood the ground and stood with us physicians, stood with us doctors on the front line to promote the truth. Thank you for your work and for your support. I just want my advice to the journalists, however, are beware of data without context. Data without context is something that we unconsciously do. Even within my own medical profession, I'm on a crusade to reduce data without context. The reason why is that when we present data without context, an example is Black people have the highest crime rate in the country. Black people have the highest incarceration rates in the country. Black people have the highest rates of cancer, the highest rates of stroke, the highest rates of diabetes, the highest rates of... All you see after some time is Black people, Black people, Black people. And you are reinforcing the unconscious bias in society by not providing context. And that is one of the ways that the unconscious bias has been, promoted unconsciously by constantly presenting data without context. So I am beseeching our journalists to please contextualize the data you present to the public. There is a reason why incarceration rates are highest among Black people. There is a reason why Black people have the highest rates of obesity or diabetes or hypertension. And that reason often harkens back to structural racism and the conditions in which Black people find themselves in this country. And so please avoid spreading data without context.
So well put. Thank you, Doc. Something that we hope all journalists will take to heart. We will spread this message. Folks, our guest has been Dr. Olajide Williams, who's the founder of Hip Hop Public Health and a professor of medicine and a doctor and physician at Columbia University. Thank you for your time. Eve says such an interesting discussion, and we're getting great feedback from folks who can watch this. Folks, if you just tag a friend right now, tell them to watch it. It'll rerun immediately on Twitter, Facebook, YouTube, LinkedIn, and on Digimentors.group. And with that, we'll give you your Sunday back. And thank you very much. And everyone, check out HHPH.org.
Thanks, Sree.
Thank you.
Bye-bye.
And have a wonderful day, and good luck with everything you're doing. Bye.